Now, to set another context, which is how people will be able to refer into the programme, one of the ways is through the Dementia Support Australia programme. And I'd just like to talk you through what is Dementia Support Australia. So in October of 2016, the then Dementia Behaviour Management Advisory Programme, which supports people with more moderate behaviours in relation to dementia, and supports people who are at home, in residential care, or when transitioning out of hospital, came under the governance of Hammond Care as the lead on supporting that programme. And they put it alongside the specialist, the Severe Behaviour Response Team, to offer one programme. So often we talk about No Wrong Door, the 1-800-699-799, as a way to refer in to Dementia Support Australia. So rather than focus on what level of support the person may need, this one-stop referral process allows for people to be assessed around their needs. It's been identified that therefore offers a third level of service to be offered through Dementia Support Australia, with the needs-based assessment part of the programme of the Specialist Dementia Care units and programme being supported through that programme. So it'll be one of the ways that you'll be able to refer into the programme. Steve, what do we expect from DSA in all of this?
Okay, well, the role of DSA in this has been determined to determine eligibility for people referred into the program. So we're in the process at the moment of training up our triage workers and our dementia consultants in relation to triaging SDCP referrals and to going out and performing the assessments. So our expectation would be that when you make a referral through our triage service, you get a professional response that demonstrates some expertise and knowledge around the program, and we'd expect that that professional response and expertise carries through into the assessment process, where we come out and visit the referrers at their home base as well. So all of our dementia consultants are accredited to perform their role, and they'll receive specific training, many of them already have, in both the triage and assessment process for this program. When we go out, if the client has been managed by DSA before, it's reasonable to expect from our service that our consultant will review the previous DSA reports that you've been provided with, the strategies that have previously been recommended, and review with you, the referrer, any barriers to the implementation of those strategies, why they have and have not either been implemented or indeed have been implemented yet haven't worked. We've mentioned that as part of the process, DSA's role technically ends when we've made that decision about eligibility or non-eligibility. Technically, I'm incorrect, because clearly we do have a role in providing ongoing support to people who might be awaiting an SDCP bed, having been determined to be eligible. So in other words, we're not leaving people in a void once we've determined that they are eligible. Whilst they're waiting for a bed, whilst a bed comes up, SBRT, as part of DSA, will hang in there and provide ongoing behaviour management support. And they'll be reviewing the ongoing eligibility of the client for an SDCP place as their period of SBRT involvement rolls on. And we'd actually hope that with continued SBRT support for many of those clients who are awaiting a bed, a proportion of those will end up no longer requiring the bed, because SBRT can be very successful in settling these behaviours down. So we do offer ongoing SBRT support. Of course, that's not mandatory. Many referrers don't use DSA. They use existing public or private dementia behaviour management services that also operate in this space. That's completely fine as well. You don't have to use us for that ongoing support. You can continue to use your ongoing service providers to do that if you wish. Probably important to emphasise as well that if we decline to conduct an eligibility assessment at triage, and we decline on the basis that a specialist service hasn't actually been involved to this point, we'll determine that at triage, and we'll convert the triage potentially to a generic DSA triage. You know, would you like some specialist support in managing these behaviours if you haven't had it to this point? And if so, we'll offer a DSA assessment with a view to trying to manage the behaviours with you at that point as well. We're also expecting, and we know that referrers expect from us, a timely and responsive approach to dealing with referrals that you might make. We're looking at, once the triage process has been commenced, that will be completed within a week, that we'd then be able to get out and provide the on-the-ground assessment for eligibility within a fortnight, and to then conduct the specialist review of eligibility certainly within a further 3 weeks beyond that. Whilst the program's ramping up, I'd hope that we'll be able to offer a much quicker turnaround than that. Once we have 35 units up and running, then those more extended time limits come into play. But I think we'll be very rapid and responsive to provide those assessment services in the early days of the program.